Hi everyone, welcome to Nap Time Nutrition. I'm Yaffi Lvova, registered dietitian nutritionist and owner of Baby Bloom Nutrition, and this is Nap Time Nutrition. Focus on iron. Let's see if, I guess I can't make that scroll. I was just trying to have some fun with you. So first my intro, so I'm Yaffi, registered dietitian, and I have some exciting news. Toddler Test Kitchen is going to be back and at the Farm South Mountain. If you want some details on that, PM me or check my news feed because I posted that event earlier. And Save My Sanity program is coming up. If you are a busy parent who feels a real lack of confidence and perhaps some mom guilt, dad guilt, grandparent guilt, whatever, as far as what you put on the table, you want to join me for Save My Sanity. It's not only meal planning, it is that, but it's also a basic nutrition boot camp for busy parents, and I would love to have you there. So email me at yaffi@babybloomnutrition.com or send me a PM if you are interested in that, and I'll give you more details. You can also find that on babybloomnutrition.com, and the tab is Save My Sanity program. So today we're talking about iron. It is really common to have low iron at various points in the life cycle. And since you are here on Nap Time Nutrition, it's probably because you're experiencing low iron during pregnancy or in your small child. So I'm going to focus on that, but low iron can be a problem other areas of your life. And the advice that I'm giving, it can be applied in other times in the life cycle. And I also want to say, in my normal disclaimer, this is information being given on social media, which means it does not override information that comes from someone who has your medical chart and the appropriate training. Should you want to work with someone one-on-one, if your doctor has expressed concerns about your iron levels or your child's iron levels, I am happy to do that, and I can give better directed one-on-one advice and see your medical chart. But this is generic information and should not override anything that you've been told by someone who actually knows your history and your biology. And that applies to all of my Nap Time Nutrition segments. So low iron. This is the most common type of anemia. Although there are other kinds of anemia, it is the most common is low iron or iron deficiency anemia. So who's at risk? Babies after 6 months. The most common is between 9 and 12 months, and you're going to be at risk for this if, your baby will be at risk for this if certain factors have been met. If they were a preemie, if they had low birth weight for either premature reasons or other reasons, if you've transitioned away from breast milk or formula into cow's milk before the 12-month mark. You don't want to do that. I've addressed that in certain other Nap Time Nutritions, but we should wait until the 12-month mark before transitioning to cow's milk, because not only is it lower in iron than either breast milk or an iron fortified formula, but the amount of calcium in the milk actually prevents them from absorbing iron from other sources. So you really don't want to give cow's milk to drink before 12 months. Why is it different? Why can you give yogurt and cheese? Because it's really volume. You're not going to give yogurt or cheese to replace breast milk or formula, whereas you would give a glass of milk for those purposes. So it works a little bit differently. It's not as much of a problem, but I will get into timing and how you maybe shouldn't pair yogurt or cheese with something that's high in iron. I will get into that. If you're pregnant, you have increased iron needs, and sometimes it's difficult to meet those needs. And so you may experience some iron deficiency. It's very common. Also, if you are on a restrictive diet, either during pregnancy, and I've addressed that in other Nap Time Nutritions, you should not be on a restrictive diet during pregnancy. And if you're on a restrictive diet any other time in your life cycle, you may be predisposed to be low in iron because you're just not taking in enough, or you may be combining wrong, or you may not be taking your biology into account to the extent that you could. Also, if you have irritable bowel disease, that includes Crohn's, and other types of problems, colitis, ulcerative colitis. So what are the signs and symptoms? How do you know that you're iron deficient or that your problems are because of iron deficiency? Well, the truth is that there may be no symptoms at all. Sometimes there are just no symptoms, and you need to, any regular blood test is going to show a low level, should it be a problem. But if there are symptoms, here are the common ones. Low concentration or productivity. increased fatigue if you're pale, and that could be your whole body. It could be localized to just your face, and I'm going to get fun here. If you look at your nail, the nail bed, that half moon shape, that could be a pale color, and that's going to indicate possibly low iron. Also, the inside of your lip, right there, or if you pull your eye down, I know this is fun for people who have eye issues, but you pull your eye down and you look at that space right in between your lower eyelid and your eyeball. If that is particularly pale, that may indicate low iron as well. Also, shortness of breath because you have low hemoglobin, headaches or dizziness. I know a lot of us experience that just because of the lack of sleep that goes along with motherhood. Dry, damaged skin and hair, and brittle, oddly shaped nails. And there could be a spoon nail shape. And I meant to get a picture. I wasn't able to find a picture before that. But that's really when it gets pretty severe. And hopefully you'd catch it before then, because hopefully you have an open dialogue with your doctor about these symptoms and you can catch a problem before it gets to that point. Swelling or a sore mouth. And again, this is pretty far gone iron deficiency. A smooth tongue. And it's odd to think about that, but your tongue has all kinds of bumps. It has a lot of shape to it. And if there is an odd, smooth quality to it, it could be because you don't have enough iron to develop the muscles in the tongue, which causes an odd shape. Cracks around the mouth, and you get that with certain other nutrient deficiencies as well. So if you have a lot of cracks around the mouth, that's something you want to talk to your doctor about, or if your child has it, you want to talk to your doctor about that. Also, restless legs. It's been associated with restless leg syndrome. Odd cravings. And when I'm talking about odd cravings, I mean something that just doesn't really go together, or something that isn't truly food. For instance, pica. You have a lot of association with low iron because of that. Cold extremities and a lot of infections and colds, generally decreased immune system. These are all symptoms of iron deficiency. They could be symptoms of other things, but these are things you want to talk to your doctor about or talk to your child's pediatrician. You also want to check your B12. If you're low in iron, it could be that you also have low B12, and you want to make sure. Sometimes nutrient deficiencies cover for each other, and what looks like one could be another. There's a lot of interplay with different nutrients, and if you're low in one, you're likely low in another. Or being low in a certain nutrient could actually cause a decrease in other nutrients because you're not absorbing it or utilizing it the right way. So what can you do? This is a really common question, and usually the default is to put you on a supplement, and supplements can be really difficult. They're often large, difficult to swallow. If you're putting it in something, it might not taste good, and it also can majorly cause constipation. So there are some tips and tricks that are not pills, and that's what I want to talk about. It's not that I'm anti-pill. It's that iron pills can be difficult. So if there's a way around it, if there's a way to increase your iron level to a healthy level without the pills, we can try that first. And there are some really easy, cheap tricks that you can use. So the first is pair your food that's high in iron with high vitamin C. And that could mean taking a supplement, or more fun could be have some strawberries or an orange or pineapple, kiwi. These are things that people don't necessarily know are high in vitamin C. And you can look up a whole list of foods high in vitamin C and just pair them if you're having something high in iron. And high in iron is meats, anything that is that comes from an animal, really. Although dairy, as I mentioned, can have an interplay where it actually decreases your iron absorption. And I'll get into that in a couple more points. But meat or leafy greens, these are going to be high in iron. And I'm going to post a printable where you can print it out, and it has a lot of other sources as well. And it's by no means all inclusive, but you can look up a lot of different high iron foods. I've had too much caffeine today. I'm trying to avoid migraines. I had 3 migraines yesterday. So sorry about my jittery attitude today. So animal protein, as I mentioned, is going to be high in iron. And if you want to figure out which animal protein is higher in iron than others, anything that is darker in color is going to have more iron. So for instance, this is a reason to eat drumsticks as opposed to chicken breasts. And the reason is that chickens run around on their legs, and their breasts are not quite as mobile. They don't even fly. So they need more hemoglobin in their legs to sustain the type of activity their legs do, which is running. And so you're going to have a little bit more iron in the legs than you will in the breasts, which are largely not functional for chickens. So think about that. Also, the same goes for fish. Tilapia is not going to have as much iron, being a white fish, as salmon, for example. So that's a way that you can look at something and know how much iron it has. And it's not perfect. There's always an exception. Avoid calcium in the same meal as a high iron food. And I touched on this earlier. If you're going to have spinach, for example, and my next point is cooking your leafy greens. So you want to lightly boil your leafy greens so that the oxalates come out of the food and into the water. And oxalates like to bind iron, magnesium, and zinc as well. And so if you have foods that are high in oxalates, it's going to actually take those nutrients out of your body. So when you're going to have, let's say you're going to have spinach, let's boil your spinach a little bit. And steaming doesn't work because it doesn't have as much water in order to take those oxalates out. So you want to boil your spinach a little bit and don't serve it with cheese or milk. You want to serve it with other things, maybe with tomatoes, which are actually high in vitamin C, and that's going to increase your absorption of that iron. So you want to avoid having dairy, for instance, in the same meal as something that's high iron, just because it works against each other. You want to separate them by an hour, 2 hours. That's enough. Cook in a cast iron pan. Cast iron pans are readily available and they are pretty cheap, and it's a hefty piece of equipment. You want to season it, and I can add a link. Let me just make a note on the care of cast iron pans. You want to season it to make sure that foods don't stick to the bottom, but cooking with a cast iron pan is beneficial because the iron in the pan actually does get into the food. And this is a good thing because you can increase your iron that way. And that's a really easy, cheap way. You also want to avoid tea with meals, and that's black and green tea. This is because of the oxalates that I mentioned when I was talking about boiling spinach. Tea has high oxalates, and that's going to bind to any iron, magnesium, and zinc, and possibly other nutrients in your meal as well, and not let the body absorb them in that meal. So you just don't want to have tea with your meal or milk. So pick something else. Maybe a little bit of orange juice or a glass of water is always a good thing. So you want to avoid that. I'm going to post the printable that I made with all of these tips and tricks. You can print that out and stick it on your fridge. Share this with anyone who needs it. Low iron is sometimes something that leads to poor sleeping in kids. So if you find that you're having trouble with your baby sleeping through the night, and I'm talking about 9 months and up, it's something to check. And even if you don't want to check, you don't want to take the child to the doctor and, I hate that. Here, stab my child. I'm not so good with that myself. So if you want to just try some of these tips and tricks and see if they work, that's fine. If you do have any more of those symptoms, you really do want to talk to the doctor and get that level tested. If your only symptom is they're not sleeping, try cooking with a cast iron pan, separating your meat from your calcium, and boiling your leafy greens, and see if that helps a little bit. But you always want to be able to have an open dialogue with your doctor. If you don't feel comfortable having an open dialogue with your doctor about this or anything else, it might be time to look for a new doctor because you really have to be comfortable. So that's it for this Nap Time Nutrition. I am open and welcoming questions, comments, and come to next week's Nap Time Nutrition on Tuesday at 1 p.m. Arizona time, which is 3 p.m. East Coast and 1 p.m. West Coast. Join Save My Sanity. I have lots of tips and tricks for you on feeding your family and keeping your mind intact as much as it can be being a parent. Nap Time Nutrition next week, I mentioned, and Toddler Test Kitchen, which I mentioned it's going to be at a farm on November 25th, and that's very exciting for us. So I will post that link as well. And if you have any groups or a small group of friends who are having issues with any particular type of nutrition, parenting, confidence at the table, please let me know, and I would be happy to speak to your group. So email me at yaffi@babybloomnutrition.com. Check me out on Pinterest. You're already here right on Facebook, where I have a lot of content. You can binge watch me at this point, should you so desire. And I will see you next week. You won't want to miss it.